At GP clinics like this across the country, staff were swamped with patients wanting to book COVID-19 vaccine appointments.
The receptionist getting slammed with multiple phone calls over and over, having to tell patients, disappointingly, that we just can't give them an appointment.
Unfortunately, we're not taking...
This practice in Adelaide has 3,000 eligible people on its books.
But if we've only got 300 vaccines, then we have to ration those out.
The government's website to book a jab went live today, but many people had trouble.
These booking systems are being created and they seem to be adding to the complexity rather than helping it.
There are problems at this very, very early point with exactly getting your appointment, and it's just because there's an overwhelming demand and not quite the supply yet in terms of vaccine.
But already we are seeing widespread confusion and widespread frustration on the part of GPs and patients right across the country.
The government is urging people to be patient.
It's very important to understand not everybody will be able to be vaccinated on day one.
More than 200,000 Australians have been vaccinated so far, but there are about 6 million people in the next phase. When GPs start COVID vaccinations next week, Eileen Briggs wants to be first in line.
I don't want to get sick. The more vaccine around, the more people are injected and the disease is more under control.
This practice has set up a dedicated space to give people the jab.
We need to separate it from our normal daily, if you like, sick patients so that healthy patients can come to get their vaccine.
Patients check in here, then head to a special waiting area. They'll go to a separate room for their shots.
There's a lot of infrastructure, there's a lot of staff time, and I don't think the Commonwealth Government nor the state government have recognised the costs involved.
Ultimately, more than 4,000 GP clinics will deliver the vaccinations. Many doctors hope these teething problems will be ironed out as more vaccine becomes available. Sophie Scott, ABC News.